even hard to breathe out of them. So my suggestion is just to use something that you can put around your nose and face. You can tie up a bandana. You can wear. There's a guy who was using a T-shirt, folding it up a certain way with a paper towel in between. What I'm saying is that it's not absolutely necessary, but if you're in a cloistered environment, in a clustered area, it might make sense to use it if you're going shopping, for instance.
I would think the bigger risk is the fact that we don't know if we're infected or not. We may feel fine and 3 days later be sick as a dog, and we've gone out and affected somebody that could then affect, like, my 99-year-old grandmother.
There is a twofold benefit to it. Yeah, we do see there's a period of time before someone develops symptoms, usually about 2 to 3 days, where there is enough viral replication that can be spread through respiratory droplets. So yeah, that is another benefit, and possibly even more benefit than this whole airborne concern. So I do think there's a good appeal to using a mask.
I would think that we need more information on the incubation process in order to be able to plan ourselves a little bit better.
Yeah, I mean, the incubation period is not completely unknown to us. It's about 2 to 14 days. So it's longer than the flu, which is around 1 to 7 days. So there is a little bit, and of course there's outliers. But I think that's the challenge, is if someone is developing an infection several days out, when does that tip over to a clinical presentation? It could be several days of potential viral shedding.
I have a question.
Yes.
You briefly touched on animal transmission. Could you expand and share any information you have about animals or pets, any precautions we should be taking?
Yeah, it's a good question. I would suffice it to say by the fact that this is what's called a zoonotic virus, and that means that it has a reservoir in animals. So the closest linked through sampling, the closest linked coronavirus was the one found in bats, and that it apparently was 98% genetically similar. The thought is that either through transmitting to humans, a mutation occurred within the human, or through transmitting through a secondary animal, such as in this case, it was a pet, what is it called? I lost the name, but it was a small kind of dog-like animal. So what I'm saying is that our pets potentially could acquire. We know that there was a Bengal cat in a zoo that was identified, a Bengal tiger in a zoo that was identified as being positive. So it's possible that the virus can be transmitted to pets. Now, what's it going to do there? We don't know. Is it just a dead end? Is it going to actually cause infection? Is it going to be a reservoir? I think the likelihood is pretty